Good morning. Today we are going to talk about sentinel event investigations, which are very important for any quality department in the United States where the hospital is accredited by the Joint Commission. So, how are sentinel events reported to the Joint Commission, investigated in hospitals, and how are root and contributing causes of a sentinel event determined? This is Kira Johnson, who was a lovely young lady who went off to have a C-section and had a cut during the surgery and had hemorrhage and then did not survive. So that is an example of a patient safety event which was not related to the natural course of the expected care trajectory, which resulted in death. Any patient event that has death, permanent harm, or severe temporary harm while in hospital care is required to be investigated as a sentinel event and reported to the Joint Commission. Investigations must be started in order to maintain accreditation with the Joint Commission for your hospital within 72 hours. The outcome of the investigation must include an assessment of what a single root cause is. And it is strongly recommended that the 5 whys technique is used to identify that, which we will cover. And then it is recommended that you have a strong corrective action in order to address that root cause. So what is the 5 whys technique? With the 5 whys technique, you ask why 5 times. So human error is always the first why. It is very natural and comfortable for us as humans to say somebody made a mistake. A nurse harmed a patient by giving the wrong medication. And so that is the first why. And then you keep asking why. Well, why did that happen? Why did that happen? Why did that happen? Why did that happen? And the idea is after you've asked why enough times, you have 5 whys. And then your ability to improve the system safety lies at the farther away you get from the immediate perpetrator of a crime almost. So where is the system level ability to protect patients? And can we identify those and make those changes? So just laying this out sort of generically, what did a person directly taking care of a patient do that was a mistake, error, or violation? What deviations from work as intended, from what we've talked about before, occurred? What did another person fail to do, typically in some kind of oversight role? What in the system made it easy to either make that mistake or miss catching that it happened? And in general, how is the organization set up with incentives, particularly financial incentives, that allow people to get away with or even be encouraged to do workarounds or to do formal processes that are different, to do work as done that is different than the formal processes? So here is an example of a sentinel event at a hospital where a patient received 10 times the dose. So this is a wrong dose error. So instead of getting methadone at 7.5 milligrams, a patient received 10 times as much on an acute care ward, meaning in the hospital, at 7:30 on a Wednesday. The patient was then transferred to the ICU, and this was a morbidity case in that there were no lasting ill effects. The patient stayed some more days in the hospital, but then was ultimately fine. So the root cause of the sentinel event was that the 75 milligram dose was only available in liquid form, which meant that the nurse had to manually calculate how much to give the patient rather than having the exact amount of medication in a barcoded package given and labeled with the patient's name on it. So how does that play out with the 5 whys? So the first why is, what's the mistake? The mistake is the nurse gave the patient 10 times the dose. Why did that happen? Well, the First why is that there's word stock, which is liquid in a large bottle used for independent of patients. So it's not an individual medication. It's not individually barcoded, individually labeled with the exact dose in it. The pharmacy, well, why did that happen? Because by policy, the pharmacy does not dispense high doses of methadone for individual patients as unit dose. It's considered too clunky, and let's do it this way. We'll just keep the methadone on the shelf. It's sort of hard to give a unit dose liquid format. Packaging is difficult, storage is difficult. So let's just use word stock. Well, why does that happen? Because nurses routinely use word stock. So they've been giving high doses of methadone for a long time as work is done systematically across all nurses, even though it's not what's documented in the policies and procedures. Well, why does that happen? Because basically, the nurses were told that they were good nurses. They were doing a good job by finding a way to get the methadone to the patients, even though the pharmacies didn't deliver individual unit dose medications. And it's good that they didn't complain about it. So overall, sentinel events are reported to the Joint Commission. The Joint Commission requires that these sentinel event investigations start within 72 hours, that there's a root cause, and that there's a corrective action that is implemented. In this case, the corrective action with the methadone example would be no longer allow any word stock dosing on methadone. The Joint Commission recommends the 5 whys technique be used because they do not want to have any root causes reported to them that are human error. They want to look at the system level contributors and make fundamental changes in the system. Thank you for your attention.